Imagine a place where mothers drive 70 miles or more for prenatal care. A place where rural hospitals vanish, leaving entire counties without a lifeline. Where preventable deaths haunt families because help arrived too late. That is the Texas Panhandle today, but it doesn't have to be tomorrow. My name is Jennifer Schiele, a business coordinator in the GYN Department at Texas Tech University Health Sciences Center, where I'm part of a team addressing maternal health disparities in the Texas Panhandle. I'm here because of a deep commitment to improving maternal health in underserved communities, particularly in rural Texas. I have seen firsthand the struggles people face when they don't have access to the right resources or support. That's why I became a certified community health worker and a certified maternal mental health community health worker, to be a bridge connecting people to the care they deserve. I believe in the power of community health workers. We provide education, advocacy, and support to ensure that no one has to face challenges alone. Expanding this workforce, especially in rural areas, is critical to the future of healthcare in Texas. Community health workers, or CHWs, are the frontline connectors between the healthcare system and the people who need it most. As trusted members of the communities we serve, we provide culturally competent care, helping people navigate insurance systems, understand health conditions, and access vital resources. In maternal health, CHWs play an essential role. We provide prenatal education, connect mothers with critical resources, and support postpartum care to improve outcomes. In high-risk pregnancies, early intervention by CHWs can mean the difference between life and death. Despite the proven impact of CHWs nationwide, Texas was excluded from a critical Capitol Hill meeting with Congress, hosted by the National Association of Community Health Workers. Why? Limited representation and funding gaps left our state without a voice, which exasperates the vulnerability of our population, a population who feeds, clothes, and fuels the nation. Here in the Panhandle, we're battling healthcare shortages, maternity care deserts, and workforce gaps every day. Over 35% of U.S. counties are maternity care deserts, with no birthing facilities or maternity care providers. Yet CHWs step up, reducing preventable hospitalizations, boosting Medicaid access, and delivering vital support. Texas deserves recognition for this work, not exclusion. This isn't just a missed meeting, it's a missed opportunity with real consequences. Mothers drive hours for care, families wrestle with Medicaid delays, and preventable emergencies spiral into tragedies. Texas cannot be sidelined again. We're calling on Congress to acknowledge CHWs as essential workers and ensure Texas has a seat at the table in future policy talks. Investing in CHWs isn't just a choice, it's a necessity for cost savings, better outcomes, and stronger communities. CHWs are not a partisan issue. They align with core values across the political spectrum. For conservatives, CHWs embody personal responsibility, community-driven solutions, and fiscal responsibility. They help individuals manage their health, reducing the burden on emergency rooms and government programs. For progressives, CHWs advance healthcare for all, ensuring vulnerable populations receive care regardless of income, zip code, or background. No matter the political stance, CHWs drive solutions that improve outcomes and reduce costs. According to the CDC, CHWs reduce hospitalization readmission rates by 25%, saving facilities and taxpayers millions. How? By preventing costly repeat hospital stays through early intervention and support. In diabetes care alone, CHWs cut annual health care costs by up to $1,200 per patient through better management and fewer ER visits. CHWs improve outcomes while making financial sense, saving lives, and taxpayer dollars. But here's the catch. Those savings mean little if the healthcare system itself is crumbling. Since 2005, over 20 rural hospitals have closed in Texas. leaving many communities without essential services. Nationally, 1 in 25 obstetric units closed between 2021 and 2022, with 52% of counties lacking a hospital with obstetric care. In the Panhandle, 80% of rural counties are losing population, which leads to even fewer providers and less funding for healthcare. Imagine a region where there is only one OB/GYN for every 15,000 rural residents, or only one mental health provider for every 1,200 people, where nearly 30% of rural Texas women live more than 30 minutes from a birthing hospital. This lack of access means longer waits, longer drives, and too often, no care at all. Only 7 out of 26 counties in the Panhandle have labor and delivery services. Expectant mothers in nearly 3/4 of our region must travel over 70 miles to give birth, a distance mirrored statewide. More than 15,000 babies were born in maternity care deserts across Texas. Up to 42% of Panhandle women miss first trimester checkups, increasing their risk for complications. Statewide, 20.4% of women receive inadequate prenatal care, with even higher risks in those vulnerable areas. Texas has one of the highest maternal death rates in the country, with 23 moms lost for every 100,000 births in 2020. Leading causes include hemorrhage, infections, and cardiovascular conditions, issues that CHWs can help identify early. The most troubling fact? Over 80% of these maternal deaths are preventable, 68 out of 85 in 2020 alone. Community health workers are the heartbeat of hope in Texas's healthcare crisis. They don't just fill gaps, they build bridges. CHWs deliver education, secure resources, and guide families through their care. For high-risk pregnancies, their early intervention can tip the scales from tragedy to triumph. But CHWs don't just transform lives, they also transform the healthcare system. Their impact isn't just felt in the families they support, but in the dollars they save. Investing in CHWs isn't just the right thing to do, it's the smart thing to do. For every $1 invested in CHWs, the healthcare system saves 3. The National Association of Community Health Workers highlights this return on investment, proving prevention pays off. By connecting people to early care, CHWs stop small issues from ballooning into emergencies, reducing hospital readmissions by 25% and saving millions for facilities and taxpayers. It's not about adding costs, it's about investing in a lifeline that pays off. But it's also not about the numbers. It's about real mothers, real families, real people. The Vibrant Moms Project is addressing a critical maternal health crisis in the Texas Panhandle, where too many mothers miss early prenatal care and opportunities for preventing complications are missed. Delays in Medicaid coverage often prevent women from receiving care until their 2nd or 3rd trimester. In our priority counties, up to 42% of women miss their first trimester checkups, far surpassing the statewide average of 20%. Preeclampsia hits 6.6% of pregnancies here, driving severe complications, preterm births, neonatal intensive care stays, and substantial hospital bills. Yet awareness is shockingly low. Only 4 of 94 women we surveyed knew low-dose aspirin could prevent it, and that's a deadly gap. CHWs are the backbone of Vibrant Moms, bridging this health care to moms who need it most. They will be educating on risks like preeclampsia, assisting with health insurance navigation, and connecting families to much-needed care. One mom we helped was drowning. 2nd pregnancy, preeclampsia, no support, raising a young son alone. A CHW stepped in with access to medication help, a car seat, and a support group. Her response? Simply, "I'm not alone anymore. That's the CHWs at Vibrant Moms in action, saving lives one mother at a time. The model works. Now it's time to scale it across Texas. Texas needs CHWs to thrive, and Congress holds the key. Here's how you can act. First, provide sustainable federal funding to train and employ CHWs, building local workforces that save lives and dollars. This includes co-sponsoring the CHW Access Act, which would enhance CHW integration and support Texas's HB 1575 Medicaid reimbursement efforts. Second, expand Medicaid coverage for CHW services, ensuring they're reimbursed and accessible to every family. Look at the example Texas has already begun with HB 1575 and presumptive eligibility programs. This requires opposing proposed Medicaid cuts that threaten our 23.8% uninsured population. Third, champion bipartisan legislation to recognize CHWs as essential, locking in national standards and support, addressing the clinician shortages plaguing 36% of U.S. counties. This includes co-sponsoring the National CHW Awareness Week resolution to raise visibility, building on those Texas programs, also like Hear Her and Text Our Moms. Congress can fund the lifeline Texas deserves, because healthier moms and stronger communities start with CHWs. Let's make it happen. The solution to Texas's healthcare crisis is within reach. CHWs are a proven, cost-effective answer to growing disparities. They improve maternal health, reduce ER visits, and lower healthcare costs. The data is clear. Investing in CHWs means saving lives. But we need Congress to act by supporting the CHW Access Act, Awareness Week resolution, and opposing Medicaid cuts. Texas must have a voice in this conversation, and CHWs must be recognized as essential. Let's ensure that every mother, every family, and every community have the support they need, because when it comes to the health of Texans, we cannot afford to wait. Do you see the difference that CHWs make? Toy drives lifting spirits, piñatas bringing joy, consulate support uniting families, and healthy babies born to vibrant moms. This is the future we're fighting for. CHWs are saving lives every day. Now we need Congress to ensure they can continue their mission by backing the CHW Access Act, Awareness Week, and Medicaid protection. The time to act is now.